Good evening, Bistro fans. Jill here with Dr. Christina Cole with Advanced Animal Chiropractic. And we're back for another Monday night chiro chat. So we're on a roll. We are moving along the spine and have a new topic tonight. We're going to talk about IVDD. But before we go down that road, Dr. Cole, why don't you tell us about some of the animals that you and Dr. Grant have adjusted? I know obviously there needs to be some sort of spine for manipulation. Yeah. But what are some of the animals that you've adjusted? I mean, obviously at our store you do cats and dogs, but I know Dr. Grant goes around to different horse barns. And what else?
Yeah, so that would definitely make up the bulk of it, dogs, cats, and horses. But we have done as small as like a baby squirrel, a couple squirrels actually, and then baby raccoons, and we've done goats and steers and bunnies and guinea pigs. So, and I've done a bird. So there you go. A little bit. That was just in the last couple months. So okay. A little bit of everything.
Interesting. And so out of curiosity, so I know in your certification course, you guys are pretty much practicing on a daily basis. Are you presented with some of these unique animals, or do you guys mainly go to horse barns and shelters and work on small animals and
mainly farms and shelters? So we don't get a ton of exposure to like the exotics, that's for sure. But there are farms that have the sheep and the goats and that sort of thing. So we can get a little bit of practice on those guys too. It's obviously not a super common thing that we see, but every now and again we get it. A lot of times, because 4-H is so big around here too. I think when those shows are nearing, we tend to get a couple random calls like that. Oh, we've done an alpaca too. So super fun, like bunch of weird things. But hey, I mean, Detroit Zoo can give me a call anytime if they've got anybody that needs some work.
It would be quite a fun resume to add.
It would be super cool. Detroit
Zoo.
Yeah.
Lemurs and camels. I don't know what else is over there.
I don't know that I'd mess with a camel. Like, how could they even be adjusted with those humps? Like, where's my wall?
I don't know. I would imagine their neck would need some work.
Their neck would probably like a giraffe too. Like those bad boys would need some work. But fun fact, giraffes actually have the same number of cervical vertebrae as every other animal. They just are huge.
That is a fun fact. That's interesting. I guess I would have imagined there would be more, but that would make sense. You just have bigger parts.
Giant.
Yeah. So so you and Dr. Grant actually started out in the human chiropractic world. What made you want to transition over to helping our pets?
You know, I actually never intended to work on humans. It was just kind of like a means to an end. So I knew either I had to go the veterinary or the chiropractic route. And since I didn't end up choosing the veterinary route, going the chiropractic route, I still had to get my degree. So I still had to work on people. But I never intended to continue working on people. Grant, on the other hand, did plan on working on humans. And then once he opened his practice up here, it didn't jive with him. You know, sometimes you kind of have to find out the hard way that something you might have thought was going to be awesome really wasn't. And I think, especially in our society that it's become like super obvious nowadays, it's very tough to educate people on health. And I think they're way more willing to listen when it comes to their pets for whatever reason it might be. Whereas humans, they have a very hard time changing their routines. And if their routine is what's causing them to have issues, then you're kind of at a standstill. So I think for Grant, it just got to a point where he felt like he was talking to walls like all the time, and he just wasn't feeling very fulfilled. And so interestingly enough, like Grant didn't grow up with animals. You know, he really didn't have that until he was maybe in his teens, I think, because his dad eventually did get a dog. But it was kind of after the point of when Grant would have been living with them as an adult. So he kind of got thrown into it with me because that's like the story of my life is animals. But I think it really started with our first dog, and he fell in love with him, and then the ball just kept rolling, and he kind of just said, "Hey, I don't think I want to work on humans anymore." And I was like, well, convenient enough. I need some help. And it just so happens you can go get certified in 3 months. So go do that and let's make this happen. So it's been awesome. I mean, it literally has been 3 years that he hopped on with us, which is crazy when you think about it, because he had his practice for a year too. And it's just like, it blows my mind that was 4 years ago.
Yeah. Yeah, that's fantastic. And you're so right. It is sometimes a lifestyle change. And we notice that even at our store when, people sometimes make the change even nutritionally with their pet, and then they start incorporating that for themselves, or it goes the other way. They've already incorporated that for themselves, and they start to think like, why aren't we doing this for our cat or dog? So,
totally.
Which completely fits with our thought processes at the store, and why we love having you guys come in and be able to care for animals at the store.
Heck yeah.
Awesome. So tonight we have kind of a big topic. We are talking about IVDD. So if you could maybe lead us into that, and what exactly does IVDD stand for, and what is it?
Sure. So IVDD is a term thrown around a lot nowadays, especially with our pets. It stands for intervertebral disc disease, which basically just means a condition of the area between your discs, or between your vertebrae, aka your discs. So it's become a lot more common in several breeds, but basically what it is, it's the weakening of your discs. So your discs are composed of like this fibrocartilaginous viscous fluid, right? So it's also got this harder outer shell that kind of holds everything together. Think of like an egg. You've got like a protective shell and more of like a fluidy type thing in the middle that acts as in our case would be a cushion. What happens with IVDD is this outer shell starts to thin and starts to wear, usually a lot earlier in life than it should. And when that happens, you can also kind of think of like when you take a full balloon and you squeeze it and you start to see another area bulge and the latex gets really, really thin when you're squeezing it. That's kind of what starts happening is you get this normal pressure on your discs, which they should be able to withstand, but because they've weakened and because they're not as well contained, they start to bulge out and kind of squish and go into the actual spinal column and put pressure on your spinal cord. So that's when it becomes a real problem, is when it starts intruding into that spinal canal. It's really very common, I would say, at least what we've seen nowadays. We have dogs coming in all the time with IVDD or diagnosed IVDD. And it ranges for sure in like the way the symptoms are, but there are technically 2 types. They're called Hansen type 1 and Hansen type 2. So it'll kind of address both things that we see. So type 1 is more of that acute, tends to be seen in younger animals. And it tends to be more of like that sudden rupture or herniation of a disc, as opposed to your type 2, which is more of a slow, progressive, and kind of like what we talked about last week. It can mimic that like drunken back end, and it's not this like snap of the finger, your dog's lost their back end sort of situation. It's more of a gradual protrusion into the spinal column as opposed to a quick burst into the spinal column. So you've got those 2 types, and it's important to recognize the difference, just because it's kind of it's a different reason as to why it's happening. So a lot of times with the older dogs, it's obviously this wear and tear on their body. With these younger dogs, it tends to be more of like an action related thing. Like they've, been jumpers their whole life, or again, they've got that squished or stretched spine, or those sorts of things can contribute too. So there's different things that we can do to kind of address both of those issues. Basically, it's not a fun thing to deal with. So it is common. You've got this like early stage, almost like squishing of these balloons that should be cushioning your spine. And when you have a 3 or 4-year-old pet coming in that can no longer use their back legs, or they're in severe pain, a lot of folks don't know what to do because they're not given a lot of options, and it can be very difficult to kind of wrap your head around a lifetime of problems because of this disorder. Jill, if you want to go to the next slide, I'll talk about some of the symptoms and
yeah. I'll pull up the video. Maybe. There we go.
Yeah, so this is one of our lovely little rescue dachshunds she was in foster care when she was seeing us here, but her name was Amelia, and she was in so much pain and super hunched and looked like she was like a 15-year-old dog when she was much younger than that. And you can just see like the hunching in her low back. And then if you look to the right, this is after I think 2 or 3 adjustments,
wow.
She was happy as a clam and just like feels so much better, but her back isn't arching anymore or anything like that. So when it comes to IVDD, there's, like I said, a huge range. There's a big spectrum of how it presents itself. So she's definitely not one of the most severe, because I would say the most severe are the ones that come in with partial paralysis. But she's definitely on her way to that. So that's the thing. This is a progressive condition. If that's not addressed, you're going to eventually have a dog that is partially paralyzed, because at a point that will rupture, or it will impede so much on the spinal column that you're just basically turning off communication with the brain to the body. So basically that's what's happening when these discs are putting pressure on the cord or going into the spinal column. It's causing irritation of the nerves, which is why even in this one, you can kind of see this dog is very painful, and it is like toe tapping, not wanting to put much pressure on it. And you can see the arch in the back as well. So that's a super common symptom, is you start to see this arching in your dog's back. That's not a normal thing. These animals should have level top lines. And I would suggest that anybody that notices their pet starts to have that little bit of an arch in their back, definitely get them checked out, because that's not a normal thing. They should be completely level. When you start to arch, it's almost like their inherent way of trying to relieve pressure on their spinal cord by opening up the disc, right? And try to relieve some pressure on it. And in all reality, what it does is it ends up closing down the front end of the disc. So it's like insult to injury, but how are you supposed to tell them that? So yeah, we've literally got all different sorts. This one is having a really tough time with those back legs, and then happy as a clam over here. So they basically all present a little bit different. You get the ones that are just limping. You get ones that are drunken. You get ones that literally are totally paralyzed in their back legs. It's really a range. So this one, her name was Lila, was really, really bad. You can see, but the good news is she still had function in one of her legs. This guy too, they all come in. And if anyone's noticed a pattern, it does tend to be these long backed dogs. It's a problem, they'll start to knuckle, they'll start to trip. Part of the problem with IVDD is, or at least type 1, with these younger pets, now this one, she was actually told she couldn't move at all. She couldn't even move around with both her front and her back legs. That was really, really bad. And that was actually in her neck. So a lot of times folks don't realize that when you have a disc bulge in your neck, it absolutely will affect everything below. It's not just going to be your front limbs. So a lot of the disc problems we see tend to be in the low back, and those tend to be the drastic ones like what you're playing right now, where they're totally paralyzed in their back legs. Now he's 15 and a half. That's crazy. And he totally recovered. Hooch is only 2, this dog that you guys are looking at right now. And it's just the one back leg. So it's one of those things where they all present differently, but these are all cases of IVDD.
Wow. Just
in different showings. So I always tell folks that come in when their dog is hunched that it's actually a blessing in disguise. You'd rather them show you these symptoms so that we can work on it and fix the problem, as opposed to your dog goes out to potty one day and then is completely paralyzed, which is more often than not the case that we see, just because they're younger and they're really good at hiding any kind of pain or discomfort. It's, again, it goes back to that being a wild animal inherently. If they show weakness, they're lowest on the totem pole and they're left behind. So, there's no way for us to explain to them, we're not ditching you. You're with us, you're safe. You can show us that you're hurting. They don't understand that. So every now and again, you might get someone that their owner describes as dramatic, but more often than not, pets are not really of that type. They tend to be more stoic. So if they're showing you symptoms, then there's definitely something going on. Like that's not a good sign. So when you start to see that arching, or you see them starting to drag a little bit in their back legs or their front legs, you see knuckling. Really, if you just see, oh, this is one of my favorites. This is Archie. He literally had no function in his low back, and he is 14 and a half too. So it's pretty crazy. It's not just limited to 14-year-old dogs, and it's not just limited to 3-year-old dogs. All of these animals were covered just doing alternative care for their pets. And I would say 99.9% of them were told, either do surgery or put your pet down kind of situation, because there's not really a chance for them to recover, which is so sad, because look at that. Like, this could have been so many pets that would no longer be here. And it was a simple fix. It's a disc issue that if we can address, it's so much better. So it's kind of crazy when you really look at them and look back at all these different animals and how they all presented so differently. And the other thing is, like, when it comes to IVDD, there isn't always pain. So like these guys that you're seeing, those are pretty painful dogs. If they're still on all fours and able to use them, usually that tends to be a dog that does have pain. If you get a dog that's totally in a state of partial paralysis, their body has completely shut off. So they're not feeling any kind of pain back there. So it looks awful, obviously, because the dog's like dragging themselves around, but it's harder for us to watch than it is for them. Most of those dogs that are partially paralyzed are like, la-di-da, good to go. I'll just drag myself around. No problem. No. Very rarely are they like the woe is me, I'm in a lot of pain type. So there's kind of like two different sides of the spectrum. But yeah, so symptoms, I'll just name them off. They tend to be back pain, a really weird gait, which you can see in all of those, in the majority of the videos where they're still walking. It's this weird, wonky, drunken, or very stiff. A lot of times they'll be sideways or curved, like a C curve. You'll look down their back, and if you're looking from above, it'll look kind of like a C. Hunching in the back is a huge one. If you have a dog that's always been a jumper and suddenly they're hesitant, that's not normal. Something's going on. If they're uncomfortable trying to go to the bathroom, so that squat or that arching, if they don't want to do that, then that's also a sign that something's going on. If you ever stroke down your pet and you feel them really tense, or like they almost feel bloated, or all their muscles are just guarded along their abdomen, that can be a sign of a disc problem. Just generalized decrease in activity, lethargic, anything like that can show you that something's going on. Some of these dogs lose all control of bowel and bladder, but usually when they do, they've also lost control of their back legs. Very rarely is it one without the other. If you notice your pet starting to tremble or shake, especially in the younger ones. In older dogs, it's not abnormal as they start to age for you to get a little bit of that shakiness in their back legs as they weaken, but that's usually in your super seniors and not so much in your 9 and 10-year-olds. And it's also not something that one day they were fine and the next day they're shaking. It's kind of a progressive thing. So if you notice that, that's a big point too. If you notice dragging, knuckling, tripping, if you're on walks and all of a sudden your dog is just not having that smooth gait, if they've slowed down and they tend to cross their back legs over, those things are all things to keep an eye out for. Sudden weakness, if you notice your pet collapses randomly, or like almost has a short circuit, those sorts of things are often disc related. And then of course, paralysis. That's like the end all be all. If you start seeing total paralysis in either the front or back legs, that's definitely something to be concerned about. And I would say there are those rare cases where it is something more going on, as in you might have a tumor or they've thrown a clot or something like that, but it's very rare. And it sounds goofy, but I will say this, Grant and I have probably encountered, in all the dogs we've seen that have come in with disc disease or paralysis, there have maybe been 3 that just, even in the way they present, doesn't quite fit the mold for your typical disc disease. They just don't recover the right way, or they're not recovering very well, or they are in extreme pain, yet they're paralyzed. Or if they worsen very, very quickly, which is not super typical. a lot of times those pups have ended up having tumors, which are not something that is going to get better anyway. So what we oftentimes say to folks, if their dog comes in and presents pretty normally with what we see, where they still have deep pain in their back paws, or they still have a tiny bit of movement, they're not in pain, those sorts of things, you've got a pretty dang high chance of recovery, as opposed to the ones that come in and they're lacking deep pain, or they just don't quite fit the symptom profile. And with all three of those, we were working hand in hand with different vets, and you just saw how quickly they went downhill, which is not typical of a disc disease dog. So usually when it comes to the most severe case of disc disease is paralysis. It's not going to be severe pain or inability to function, more or less. Like, they still have that happy energy. They might be a little bit bummed because they don't understand why their back legs aren't working, but very rarely do you have all of those things coming together. And when you do, that tends to be something a little bit more serious. But again, something we can figure out when we're looking at your pet. But we've seen hundreds of cases, and I would say, again, that's super duper rare. It's not something we usually see. The most affected breeds, again, are going to be your stretched or your squished guys. So think of it like your Dachshunds, your Frenchies, Corgis. Anybody that's overweight is more prone to disc disease too, especially if you're those breeds and you're overweight. It's not a good situation. Beagles are prone to it, Shih Tzus, like really anything that kind of was almost meant to be bred as like a ratter, which I think a lot of them were, to crawl into little puppy holes and get under crawl spaces. Like, those dogs tend to be short-legged and long-backed, and they tend to have some issues. For your type 2 disc problems, which tend to affect the older dogs, those tend to be more your Dobermans, German Shepherds, those guys, which is more of like wear and tear as opposed to this sudden rupture in their low back. Another thing I found super interesting, and I don't know if a lot of people realize this, is a couple of years ago, they did a study regarding it's something called chondrodystrophy, which in layman's terms just means tiny legs, like short bones, basically. So a lot of folks that have these Shih Tzus and Dachshunds, they'll notice that they have these legs that face out like that. Their front paws will be really dramatic, and their legs will be super short. So that's what chondrodystrophy is. Well, they were doing this whole study with, I think it was at least 100 dogs, that they found that those with chondrodystrophy, actually what it does is it causes the end plates while your dog is growing to close too soon, which is why their legs are so short. And because it does that, it actually causes the disc in their spine to calcify earlier as well. So a lot of times it kind of makes sense with those breeds that have those issues. It goes hand in hand. So those guys tend to be prone to IVDD. And it's funny, the actual study, the stat was that literally IVDD dogs are 50 times more likely to have the gene for chondrodystrophy. So it's crazy. Wow. That's a huge correlation. Like, that's not just there's a little bit of a chance. Like, you're pretty much guaranteed that there's some kind of relationship between the two. And there's actually a genetic marker that people can test for, but you kind of know pretty quick whether or not your dog has it. And I will say most folks, especially people that are breeding these small breed dogs that are prone to it, do tend to do what they can to not breed ones that do have very squatty legs or very long backs. They try to find some middle ground, or at least the good breeders do. Obviously, not everyone's a good breeder, but people just need to do their homework and find the better ones. But anyways, that's usually who is affected and what symptoms you're looking out for. So now we're going to go into how it's diagnosed and what we kind of do to help with.
Yeah.
So diagnosis with IVDD is typical. Most people will end up going in and getting an x-ray done. X-rays will at least show you if there's like arthritic changes or if there's a decrease in disc space between your two vertebrae, but it doesn't actually show you the disc itself. So it's not going to show you any soft tissue. So the only definitive way to say, yes, your dog has X, Y, and Z, or your dog has a disc bulge, is through an MRI or a spinal tap. So both of those tend to be a little bit more on the pricey side. And so a lot of our folks that come in with a diagnosis of IVDD based off of an X-ray. So it's kind of one of those things where if you're looking at their spine and there's an area that instead of being this big is this big, it's kind of like if A plus B equals C and, one of those sorts of situations, they just kind of determine, well, it's probably IVDD. And also you take into account all the different breeds and what they're prone to and their activity. So most folks will come in with an X-ray because an MRI will run you between $2,000 and $2,500. And that's just for a diagnosis. That's not going to be for the treatment. So it's one of those things where we oftentimes get folks that are like, we definitely can't afford that, but we don't want to put our dog down. So we tend to be a little bit of a last resort for a lot of folks, but we're happy to at least be a resort.
What are on that thought process, what are some of the conventional recommendations?
So it kind of depends on where you end up going or who your vet is, because there's a total different mindset depending on who you talk to. But I would say I have some friends that are vets that would say the first course of treatment should be steroids, muscle relaxers, that sort of thing. And then there's another school of thought that says steroids don't do anything. They're not going to help at all. So it's kind of like a toss up.
Right.
I guess the way I look at it is I don't think that the steroids are going to hurt. So why not try it? If your dog's not walking, the steroids aren't going to make them not walk more. Like it's either going to do nothing or help. I mean, the muscle relaxers tend to be more for the dogs that are still walking but in pain. The ones that aren't walking, I don't know that a muscle relaxer is our favorite, like the favorite course of treatment, just because their muscles are already relaxed. You've completely shut down. So in situations like that, it tends to be more of just the steroid or possibly a pain pill if you notice any pain. But most of the time, it's really just a heavy duty anti-inflammatory going in those guys. Whereas the ones that are in pain tend to be more of your pain pills, your nerve dullers, like those sorts of things to at least help them get over the hump. And that's also like a conservative conventional treatment. A lot of these pets get sent to like neurology clinics and that sort of thing where they're recommended to get an MRI or then do surgery based on the MRI's results. But not a lot of folks have $10,000 just sitting around. So
sure. Yeah, so that's I guess that was my thought process. So after you do a $2,500 MRI, now you're possibly facing upwards of a $6,000 to $10,000 back surgery that doesn't really have 100% chance of anything. It could still come out, your dog could still come out being the same or maybe a little bit better or completely healed or worse.
Yeah.
I mean, there's a spectrum of what happens there as well.
Not to mention the rehab afterwards.
The rehab and the anesthesia. And if you have a, 14, 15, 16-year-old dog, like there's usually some concern when you get into seniors too. So it just, in my mind, would make more sense of like, if you tried a couple chiropractic treatments for under a few $100s and saw improvement, then that seems like it would be a great add-on to whatever is happening within the body already. So
I think what's hard to
sounds like there's a diagnostic regimen, at least.
Well, we have a lot of times when folks will call and say, they have an MRI scheduled. And I guess our first question is always, okay, when you get the MRI back, do you plan to do surgery? And if somebody's answer is, we have no intention of doing surgery, then I guess my question is, then why are you doing the MRI? Because that's a very expensive thing to do. And if you don't intend to then follow through with the recommendations, it seems silly because the treatment would be, if you're not going to do surgery, the treatment is going to be the same, Right. And even if you got the MRI back and it did say your pet had a tumor, are you going to do that surgery? It's a lot of like, you have to sit there and really look at it and say, okay, where are we at budget wise? I mean, and a lot of times when folks go into this situation, it's like the height of emotions. So you're sitting there, you're being told like, maybe your pet will live. Maybe you should euthanize them. Maybe they will recover. Maybe they won't. And what's really interesting is with all the studies that I've read, and honestly, there's not a ton of them because first of all, there's not a lot of grant money to like look into it. And there's not a lot of who wants to be like, I'll be the placebo effect. It's a lot of politics in it. So I don't know that it's necessarily something that we'll see a lot of studies on soon. I mean, Grant and I've got 2 papers published, and then Grant and I have 1 paper published together that's about 35, like a case series of 35 dogs that we worked on and strictly did alternative treatment, and every single one recovered. So it's one of those things where they say that if the dog has absolutely no feeling in the back legs, and it's called a deep pain reflex. So a lot of times you'll see people or the vets like pinch very hard between, like in the toe webbing, in the back legs. And if you're supposed to get a little bit of a jerk response, obviously, like you've just pinched them. So they should not be happy about that. So you're looking for some kind of response in that. And a lot of times what they'll tell you is if your dog has no response when you pinch, then you absolutely have to do surgery. And the likelihood of recovery without that is slim to none. The question is, how often or not do people then say, okay, I'm not going to do that and I'm going to try something else? Or how often do people just say, well, I can't afford that, so I'm going to euthanize my dog? There's so many factors, right?
Right.
Actually, we're working on right now that with you guys, the Lily, the Beagle mix that had no deep pain in her back legs when she first came in. And now she is able to stand on her own. Like her only problem is that she can't just walk. She has to go fast, and that topples her over. So it's been a process. And like with anything, those first 24 to 48 hours, a lot of times Grant and I will tell folks, like, we appreciate you wanting to get in right away, but there's very little that can be done in those first 24 to 48 hours when your dog is so inflamed. Like the switch is shut off. The body needs to take a moment and go and breathe before you're going to see any change from what we do. So that's where we're very adamant that, like, absolutely go get some steroids. This needs to be a tandem thing with your vet, because obviously we don't prescribe anything. We can't. So it's nice when you have someone that's willing to try to go the conventional, but like a conservative conventional, because you can work together on that. And we've found that these dogs that get in within that, like, first, like I would say within like 2 to 3 days of when they've had issues in their back end, tend to do quite well. And I know it's hard to try to say, well, I need to get in within the first hours of it happening, but you're in such a state of like global inflammation at that point. Until you start to get that under control, we're just going to be adding insult to injury, because when you're working on an area that's inflamed, by adjusting it, you're dispersing more inflammation. So you need to have that regulated, which is one of the reasons once you guys started carrying the CBD, that has made a huge difference. And I would say actually has probably expedited a lot of recovery times that we've seen. So like maybe the first 3 years when I was practicing before Grant came on and before you guys really had, like before CBD was really talked about, we still had a lot of these dogs recovering, but I would say it took a lot longer compared to now, where a lot of these pets are showing improvement in 1, 2, 3 visits, even if it's minor. Like you go from a pet that is either in severe pain or can't feel anything in their back legs to getting some feeling, or, not in as much pain, trying to jump. Like those sorts of things are huge. So it's hard, I think, for owners, because you're watching it happen every day. You watch your pet struggle, but it's harder on us than it is on them. Again, it's very rarely that your totally paralyzed dog is in pain, and even your painful dog, like most of the time, those guys can be really well managed conservatively. We're huge proponents of icing. Ice is really big. I always try to tell people, do not mess with heat when something like this is happening, because heat brings more inflammation to the area. So if you can get some ice on a pet that's either in pain or has lost control of their back end, that can at least help disperse some inflammation and keep it from getting so, well, for lack of a better term, inflamed. it's one of the best things you can do. You know, the CBD, again, anytime we've ever had someone that calls and is like, my dog just went paralyzed, what do I do? Or I'm just leaving my vet and it's just happened today. Usually the first thing we say is, well, go get some CBD to start out, like get that in their system. So, and it's not going to interact poorly with any other med that you may have just gotten from your vet. Like, let's hit it with a double whammy. So that way you can at least get some inflammation down. That and rest is huge. You know, they do need to rest and let their body heal. So a lot of folks get concerned that their pets will be sleeping a lot while this is happening, but your body's healing. How do you do when you're sick? You just want to lay in bed all day. So let them lay in bed all day, you know, and I'll tell people, you know, losing bowel and bladder is really normal. All those nerves are all in the back end. So as one thing recovers, so do the other. And I really wouldn't say that disc disease dogs have any different like outcome than what we'd normally tell a new patient that's coming in. I wouldn't say, oh, well, it's going to take us X amount longer for you to see improvement. Truthfully, you still can see some improvement. It's just going to be a different form. You know, if you've got a dog that had a mild jerk response when you pinch their toes to now it's a very strong jerk response, like that's still improvement. That's good. So we'll know pretty quickly whether or not it's going to be something that your pet's going to recover from. Now, whether or not we'll be able to get you guys back to 100% really depends on the dog, the age, the weight, the motivation. There's so many things that play a factor, but I would say pretty much all of these pets have come back to anywhere from like 80% to 100, you know, and they do really, really well. It's one of those things where it makes me so happy when people aren't so quick to give up, because there's a lot that could be done for very little money to see if we can at least help, you know? And that's the other thing about surgery that always concerns me is we do work on post-surgical dogs, you know? And in fact, I would recommend anyone that's dog has had back surgery to definitely, for the rest of their life, probably get some checkups now and again with chiropractic, because you literally have a joint fused. So the joints above and below have to make up for that, right? With their mobility. So we have seen several dogs that post-surgical, they end up bulging another disc because they're compensating for it. So it's one of those things that it's definitely something that needs to be managed throughout their entire life. This isn't something that's like a one and done situation. You've got a pet with back problems, and we'll do our best to get them stabilized and back to as normal as possible. But there's always going to be some give or take, especially at home, like tile floors. You need some runners, like things like that, even when your dog's 100%. I mean, you guys know our favorite little Taz right now. He came back over a year ago from being totally paralyzed and was awesome. And then just this past summer, he was so active and he just dive bombs off their back deck and he relapsed. So, you know, he's getting better. It's slow, but he's getting there. And it's just hard to, how do you tell a 5-year-old dachshund what he can and can't do? It's not easy. So, I mean, it's always a bit of extra work. There's no doubt about it. But there's a lot.
Is that something that's common? Like once a dog already maybe has a bulge disc or IVDD, is it common for that reoccurrence to keep happening?
You know, I would say we've probably had 2 that have relapsed like that. And I think it's probably more geared towards the younger ones just because they are so active, and it's very difficult to limit them. And truthfully, why would you want to? You want them to live a normal life. And it's rare that we've seen occurrences, but Taz is coming along, and I do think he'll come back to his normal self. He's just a stink pot, you know, and thankfully his folks are super willing to just keep on with him. And it's also helpful that he loves to swim. So there's that too, that can help. Yeah. But yeah, so there's a lot of different treatments if you go the alternative route. You know, there's hydrotherapy, which is awesome. There's a ton of rehab exercises people can do at home. And we try to do our best to kind of cater some to each different case. Acupuncture is awesome for dogs dealing with this because, again, it works on making sure nerve flow is really going nicely. So I would say that like chiro and acupuncture together work really nice because we work on the structure and they work on the flow. Massage is really helpful. You know, anytime somebody comes in with a pet that's having trouble, like gentle massage can make a big difference. And then I would say, like we said, the CBD is really important, and any kind of supplement that focuses on maintaining like the gelatinous portion of the discs, like fluid, maintaining that I think is super important. But yeah, one more thing I wanted to bring up is there actually was a study done of pets that did electroacupuncture, which is like literally acupuncture with little electrical stimulus, and versus dogs that have had surgical intervention when it came to partial paralysis. And I think there were 14 in the study, but basically they compared dogs that only did the electroacupuncture, they compared dogs that only did surgery to dogs that did both. And actually the ones that fared best are the ones that only did electroacupuncture, which is super crazy when you think about it. And then secondary was the one who did both. And then all the way down at the bottom were the ones that did just the surgical intervention. So it's interesting. I think that if there are more holistic vets out there, you might start to see more of these studies, but it also depends on like owners being willing to do that. So, cause that's a big leap of faith. But yeah, that's super crazy. And I would say in our practice alone, we've probably seen at least maybe 60 to 75 paralysis patients in the last couple of years. And then for just straight up IVDD, I mean, that's the hundreds, because it's not always paralysis that comes in. Just like it can be pinched nerves, it can be all of those sorts of things, but they do awesome. I mean, everyone might need a little bit of a different cocktail to kind of get to 100%, but it's totally possible. So I would say that anybody that's struggling with it or anybody that has a pet that gets diagnosed with it, you absolutely should look into chiropractic acupuncture. And if that's not in your budget, you should at least consider doing some really solid joint supplementation so you can at least prolong something before it gets to be, something that you really can't come back from.
So I was just looking up real quick. You kind of brought something to my mind. One of the supplements that we carry, the Herbsmith Sound Dog Viscosity by Dr. Besant, she actually adds hyaluronic acid into hers, which is that joint lubrication and keeping all of that synovial fluid and all those things moving. And that is, hyaluronic acid is not found in most joint supplements. So and then she also adds the anti-inflammatory herbs in there. So she's got a kind of like a really nice little compact supplement that comes in chews or powders, depending on, and she also makes ones for kitties. Not that we do this isn't something. Have you ever seen this in kitties? Have you ever seen IVDD in kitties?
I think I've seen 2 cases of IVDD in cats. It's not as common, but it does happen. So I would say it's probably more common. It's more of a drastic change. It's either very young ones, and I would say those are kind of the ones that are more traumatic based, like your super jumpy kitties that are getting onto the top of your fridge or onto the top of whatever. That repetitive motion over and over again can aggravate it, but not nearly as common as in dogs.
Fair enough. I was just trying to see. So anyway, so she has cat and dog supplements, that helps with that. So that's fun. So, and then back to supplement recommendations. So we really talked about obviously joint lubrication and anti-inflammatories. Anything else that you can think of that might be?
I mean, I think our favorites that we've talked about almost every week is a good fish oil is huge because that's a great natural anti-inflammatory. And again, it bathes the nervous system. So that's really, really good. That, and even if they don't like that, you can always do like a coconut oil too. That's pretty helpful. It's just not as good as the fish oil in this sense. And I would say the other one we tend to have people do is, again, the turmeric or the golden paste, or now that you guys have, I think the honey hemp, I think that would be easier for some folks to give as opposed to like the earthy tasting stuff. So there's a lot of options. I would just say anything that's, if you're in the midst of one, like an episode, then definitely a good natural anti-inflammatory is important. But if you're looking long-term for something that's just like a preventative, or like anyone that has a dachshund should have their dog on some kind of joint support from like day one. Anything with the long back. I mean, anyone who wants to go through our YouTube channel and see all the dachshunds on there, it like speaks for itself. These poor little guys. At most of our clinics, if a dachshund rolls up into the parking lot, all of them are like, that must be one of yours, because so, they're just prone to it. So
I know.
You know, these poor little dudes. But yeah, and especially if you have a dachshund, do not let them get chunky. That is dangerous. Like overweight animals in IVDD is not good. It's very, very rough to come back from that. And it's a much longer recovery time. So if you have a fairly fit creature and they end up having a back problem, it doesn't tend to be, you know, like 6 months recovery. It tends to be a lot faster. So
right.
It's just one of those things with what people are willing to go through. But yeah, the hemp honey's awesome.
Yeah, so this one is the Colorado hemp honey. So it's full spectrum hemp, 15 milligrams of full spectrum hemp per teaspoon. And then this, they add the turmeric and black pepper in there. So you have like the golden paste essentially already mixed in, which is excellent. Comes in a couple different size jars. You can see here we also have like the ginger. They have a ginger, just a regular. They have a lemon one for stress and anxiety. But ginger can be actually a really fantastic anti-inflammatory as well. Mm-hmm. Especially, I always lean towards ginger when we have dogs that are on the cooler side. Mm-hmm. So dogs that are always seeking like a warm space or place. I personally, just to give a great example, am the type of person, I have taken turmeric and ginger. And I could take upwards of 8 to 10 capsules of turmeric a day and get zero pain relief. Mm-hmm. I can take 2 capsules of ginger and have pain relief within 30 minutes. Yeah. So it's just constitutionally like who I am. Mm-hmm. And then we can also transfer that over to pets just based on their personality types and if they're heat seeking or cool seeking and how that transforms and supports the body. So turmeric, although is lovely and a fantastic herb, it's not always, it's not for everyone and it's not for every pet. You might not see the same pain relief you might see with using yucca or boswellia, which is frankincense, or ginger. Mm-hmm. So those are probably our 4 top anti-inflammatories that we recommend all the time, along with the full spectrum hemp products. And the one thing that I love about our selection of hemp that we have at our store is that we pretty much have something for everyone. So we have the honey. So if you have a dog that's really picky or you need to drizzle it on their food or something like that to get it in there, we have that option. If you need a capsule because you need to sneak it in them, we have that option. If you need it in a chew or a treat that's flavored with some chicken or lamb or something like that, we have that option. Oils are probably the most popular just because they are typically the faster acting. Yeah. But again, we have ones that go with food and we have ones that go without food. So depending on, cats, it's a lot easier to put it with food, where your dogs are a little bit more apt to, you're just able to walk up and squirt some in their mouth and they're fine with that. Cats usually don't appreciate that. Yeah, we have some that's chicken flavored. We have just regular hemp mixed with coconut. We have hemp mixed with mushroom. So we have quite a bit of variety to help make it easy for you as the owner, because a lot of times we're already stressed out. Our pets aren't feeling well. Maybe we need some help. We're stressed out because
one for you, one for me.
Well, we know they don't feel good, and all we want to do is make them feel better. And it's hard sometimes when it's hard to find that grounding moment and have some patience to see what tomorrow brings rather than here and now. So. And I totally agree with supplement recommendations. We've talked about different oils in the past, in the last couple weeks. And something that just kind of popped in my mind too is that if you're working with a cat or a smaller dog, sometimes putting like the glob of oil in the food just doesn't cut it for them. Mm-hmm. So we have actually, Holistic Pet Organics does a salmon oil that's in like a spritz bottle, which is really nice. It comes in only like a 4-ounce bottle, which is also helpful with smaller animals because you'll be able to use it within like the 60 or 90 days. So it by the time you use it up, it's not rancid. Mm. And it's nice, the little spritz bottle, because it kind of sprays and coats coats your food rather than just going in and being in a glob, which cats also aren't appreciative of that. Sometimes the little guys can be really picky too, so you have to dial it up more so than a larger dog that you can just kind of ask them nicely to taste it, and they're like, yeah, that's good.
Sounds like a plan. Delicious.
I'll have some more of that, please. So, and just, what are the different ways that we can get oils in? And we oftentimes recommend a liquid over a capsule, just because the liquid is a lot easier for the body to absorb and digest, where the capsule, once it goes in and once it's in the stomach, the digestive system still has to break that capsule down in order to get to that essential fatty acid. So although sometimes it's easier to give our dogs capsules, we often recommend going with a liquid for your essential fatty acids, fish oils, things of that nature, just because it will get into the body and work a little bit faster. So I always forget about our quick little spritz bottle, and I think that's like the most brilliant thing when you have picky dogs and little cats. Let's see here. We have a comment, which I did a little bit of snooping, and it's actually Myrna.
I love it.
He's watching from one of our groups, so that's why it's coming up as Facebook user. But Myrna's over in our dog lovers group watching our interview, and she says that her new pup Emma had her genetic profile done with the breed trait, and she came back as having the gene for IVDD, which you had mentioned that. Yep. So they have an appointment scheduled with you just to have a baseline, which I think is a fantastic idea. And I think it's interesting that they can actually see that there's whether or not a gene for IVDD.
Yeah, it's crazy.
That is crazy.
Right?
But awesome. So I'm glad, Myrna, I'm glad you're bringing Emma in. And I don't know, Dr. Cole, do you have any thought process? Like, is there an age that's too young to come in to get a baseline?
Oh, no. No. I've literally worked on like 2-day-old puppies. So there's no pet too young. If you know you have a dog that's going to be prone to that, especially if you have a Dachshund or any kind of, like even a rat terrier or a Jack Russell or any of those guys, if you know that they've either got the gene for it or you just know breed wise that it's something that is predisposed, not a bad idea to bring them in as soon as you know. Like, prevention is so much easier than kind of picking up the pieces after something's happened. So that's why we really suggest it, and we really harp on making sure your pets are on a good supplement to help throughout their lives, especially while they're growing.
Yeah. So she said she's gonna bring the gene paperwork with her tomorrow. So she will be seeing you tomorrow with Miss Emma. Well, great. And while we're talking about that, why don't you tell us a little bit about your chiropractic appointments? Like, what should somebody expect during the appointment, both the initial and the follow-up with either you or Dr. Grant?
Sure. So our initial exam and adjustments tend to be between 20 and 30 minutes, depending on who you see. The follow-ups are roughly 10 to 15. So your first visit is a full history. We do a gait exam, a full palpatory thing, and then obviously they get adjusted too. So it's kind of a little bit of everything. And the follow-up is the exact same thing minus the history. So it's not just special rubbings, but special rubbings all the time. But yeah, they do really well. Right now, I'm actually working outside of the store. So if your pet seems to do better with a female, you're obviously welcome to see me. If they do better with a male, they're obviously welcome to see Dr. Grant. Like, we try to accommodate a little bit of everything. And I actually think it's kind of been nice working out front because we have a lot of senior dogs that struggle on slippery floors. So it's nice to have them just be like, oh, hello, welcome. No big deal. Don't have to roll out the carpet. But yeah, so you've got a bunch of different options. Booking is super easy. Like, you can obviously always call the store, but it's super easy to do so online too. I mean, you guys literally make it super simple.
Yep, I'll share this too. So if anyone is on our home page, let me just go back over here. It's actually at the bottom of every single page on our website, but we do have the book an appointment button that's down here that is will show you the schedule for both Dr. Grant and Dr. Christina. So you could just click on, obviously, if you have an initial or a follow-up, click on either one of them. And then from here, it'll show the calendar and their availability. We're always happy to book your appointment via phone as well. So you are welcome to call the store, but this just walks you through the process. You fill out your name and information, and I know a lot of times we get busy, so we think about these things at 9 p.m. or 7 a.m. or midnight or whatever time it is. So this is actually a great way to just jump right online. You can book your appointment. There's also information on here under About Us. Let's see, About Us, and then Wellness, and chiropractic, animal chiropractic visits. So we have some other videos here so you can learn more about actually what both of those appointments entail, and cost is here as well. So, and then you guys also see some of our service animals. So our police canine officers, we have, right now we work with nine different canine officers. So I think we have almost half of them that come in for some chiropractic care. So
yeah,
you do a great job with them as well. So we appreciate that.
Of course.
Yeah. So initial appointments, 90, follow-ups are 55. And that's for any size animal, cat or dog. Sometimes you guys give exercises as well. So depending on what's going on, you guys may end up going home with some exercises to do.
Yeah.
And then you guys are pretty good about letting people know like how often to come back. I think that's kind of a misconception. People instantly hear chiropractor and think that it correlates with the human world, where sometimes you have to go 2 or 3 times a week up front for your body to get back in alignment, where that doesn't really happen with pets. So tell us a little bit about how that differs.
So I will say, with the only pets we've ever seen more than once in a week have been disc problem dogs. So if you've got a dog that's totally paralyzed, you may be seeing us twice that first week or the second week. But depending on how they recover, we kind of make a game plan based off of that.
Sure.
Outside of that drastic of a case, we really don't tend to see pets that often. It really is case dependent. So specific to IVDD, I would say those animals do get seen a little bit more frequently, instead of maybe once you get to a point where they're doing really well, maybe once every 2 months instead of once every 3. It just kind of depends on them. But yeah, it really is going to range. If you're bringing in a puppy or a younger dog that really doesn't have many issues and it's just an athletic creature, those guys are really easy to maintain. As opposed to, you've got an older dog that has really bad arthritis that's constantly slipping, like that pet might need to be seen a little bit more. It really just depends on them, but we're happy to give people an idea when we see them.
Fantastic. How exciting. So I'm excited that, I've seen so many dogs come in that have had paralysis and have shown improvement. And you guys, the videos that we were showing at the beginning were from your YouTube channel. So if you go to YouTube and type in Advanced Animal Chiropractic, any of our viewers can go there and see. You guys have a bunch of different playlists. What else is over there? So the playlist that we were watching was for IVDD specifically. And then you guys have, let's see here, what were the other playlists you had?
I think we have a whole exercise playlist too.
Oh, perfect. Pinch nerves.
Yep. Pinch nerves. And I think
I know vestibulars is on our list. We do have, we've seen a lot of that lately. And I think that's, the interesting thing is people don't, it's hard to distinguish vestibulars from feeling like your dog had a stroke. So yeah. I know that one will be a popular one. So I'm glad you have some great videos there for vestibulars, because a lot of people don't know what to expect or what it looks like. Same thing with IVDD. I mean, like you said, they all present differently. You guys have 31 videos of, all the different ways that it displays. And I think that's an excellent place for somebody to go and watch some videos and see what exactly it looks like if they're not sure what's really going on with their dog. So yeah. Advanced Animal Chiropractic in YouTube, go check that out for sure. I think that's a great list of things to watch. So sure. Sweet. Well, we don't have any other comments. Next week, we'll have to come up with our next game plan, moving up the body. If anybody ever has any recommendations or topics that you would like Dr. Cole to talk about, please put it in the comments. We'll make sure that we put it on our list. Like I said, I know vestibulars was mentioned a few weeks ago, so that is in our lineup. If you guys have any other questions, put it in the comments too. We'll swing back around, make sure they get answered. And we're so glad you were able to join us tonight. And again, thank you, Dr. Cole, for another awesome Monday night Chiro chat.
No problem.
Yeah. All right, everyone. Have a good one.